Hi, everyone. I'm Jill Harkavy-Friedman, Senior Vice President of Research at the American Foundation for Suicide Prevention, also known as Dr. Jill. And we're really lucky today because we have a great guest in Dr. Tina Goldstein. I'm going to introduce her in a bit. I just want to note that this is Women's History Month, and here we are, two women in science and I guess in history, because the work that we both do hopefully will make a difference for people going forward and will be remembered as such. So the topic for today is sleep and the relationship between sleep, mental health, and suicide. And as one of my colleagues said, our goal is to help you all go to sleep. So without further ado, I'm going to introduce our guest, Dr. Tina Goldstein. She is a psychologist and the Pittsburgh Foundation Endowed Professor in Psychiatry Research at the University of Pittsburgh. Her research aims to better understand risk factors for suicide among adolescents in order to improve prevention effects. She has a particular interest in studying the ways in which sleep health affects mental health and suicide risk. And from an AFSP perspective, she's a member of our scientific advisory. She's actually a member of our research grants committee now. We're so excited. And she's also an AFSP grantee. So Tina, welcome. And looking forward to our conversation about sleep. I want to mention, if you have questions, you're welcome to put them in the chat and we will try to get to as many of them as we can. But I want to start off just talking about how did you become interested in sleep research?
It's a wonderful question because, in fact, it's not exactly what I went to school for. So I am trained as a child clinical psychologist. And my main area of interest has been in treating and preventing mood disorders and suicide in young people, primarily adolescents. And so when I started doing this clinical work, sitting with young people who were struggling with mood disorders and at risk for suicide, one of the things that we would be doing in our clinical practice is talking with the young people about how they got here. What were some of the things that led up to their depressive symptoms, to their suicidal thoughts, with the goal that if we could better understand those precursors, then potentially we could prevent suicide and prevent mood disorders. And one of the things that came up in those discussions time after time after time was a host of different sleep problems. And not just that sleep problems had been going on for long periods of time, though certainly that was true. But oftentimes what I was hearing is that sleep problems were getting worse around the time that mental health crises were happening. And so that got me really curious about what is this association about? Is there something causal? And more importantly, what can we do potentially to intervene on sleep to improve outcomes related to mental health? So that's how I got here.
So a sleep researcher was born. Could you tell us a little bit about what you found?
Absolutely. So when I first got into this work about 20 years ago, there was actually quite a number of studies, both in adults and in adolescents, looking at associations between a range of different sleep problems and mental health symptoms, and suicide risk. One of the things we noticed, though, about those studies is that many of them are what we call cross-sectional. And what that means is they tell us that sleep problems happen over a period of time, and psychiatric symptoms, depressive symptoms, suicide risk happens over a period of time. But what that didn't tell us so much was about the causal relationship. And that's really important for us if we're trying to intervene and prevent these things before they happen. And so that's where we were so fortunate to get funding, some of which came from the American Foundation for Suicide Prevention, to conduct one of the first ever longitudinal studies where we were closely following adolescents who are at high risk for suicide on a day-to-day basis to identify their sleep patterns over time and how those were fluctuating, both with their mood, but also with their suicide risk. And so essentially, what we are starting to identify is day to day changes within a person so that when a person gets less sleep than usual for themselves, or gets less good quality sleep, you get a bad night's sleep once in a while. What we see is that in a person who's already at high risk, whether it's because they have a psychiatric disorder like depression or anxiety, or other stressors in their lives, or a genetic vulnerability. So, for example, some of these disorders and suicide risk can run in families. Those poor night's sleep affect our emotional functioning the next day. So for all of us who have ever had a bad night's sleep, which is all of us, what we know is the next day it can be harder to, regulate your emotions. You might overreact to little things that normally would just roll off your back. And in fact, that's exactly what we found in this AFSP funded study, that among adolescents who were at high risk for suicide, the day after nights where they got a poor night's sleep for themselves or less sleep than was usual for them, what we saw is that they were more reactive to negative events in the environment and particularly with other people. So somebody could just kind of look at you the wrong way, but you would have a really big reaction, and that was associated with greater suicidal thoughts the next day. The flip was also true. After a bad night's sleep, the next day, something good could happen. You get an A on a test, or you get a present in the mail, but you just can't feel as much happiness and joy as you might normally after a bad night's sleep. And that both of those pathways were associated with increased thoughts about suicide, showing a really close association between how you sleep tonight and your emotional functioning and suicidal thoughts the next day.
Wow. So if you don't get a great night's sleep, let's say, or you don't get quality sleep, that means you're going to experience the next day differently?
Absolutely. Absolutely. Now, of course, that doesn't necessarily mean that everyone is going to feel depressed or anxious or suicidal the next day. What we know is that this equally applies across people, that poor sleep affects our ability to regulate our emotions the next day, to solve problems, to think clearly, to concentrate. Any of us who have slept poorly from time to time know you tend to be a little bit more cranky, maybe a little bit more hazy, have difficulty really coming to solutions to problems. And all of that is actually normative. There are very clear brain data that show our brains look a little different after a poor night's sleep. And that's even more true if those poor night's sleep continue over time.
It sounds like you're also saying if someone has other contributors, for instance, to suicide risk, like a mental health problem or chronic health condition or pain or head trauma or early trauma, those things might be the things that make the problems with sleep even more potent. That if you don't have those things, you just feel crummy the next day, maybe you snap a little bit. But if you do have those underlying contributors and they're also kind of not working for you, maybe you're in the middle of an episode and maybe you are feeling more pain that day, it might even make you feel more pain that day, then that for that person, that also means the risk for suicide might be greater in the days to come. It doesn't mean that if you get a bad night's sleep, that's it, you're at risk for suicide. There's a lot of different things that come together at that point in time that may precipitate the increased period of risk. And the other thing we know is that during a period of risk, if you keep people safe and you put time between, let's say, a way to kill yourself, lethal means, then that period will pass and you will still be around, you'll start to feel better, you have time to work on making things better. So it's not just if you have bad sleep, you're at risk for suicide. That's not the way it works. But we need to
Absolutely.
take care of ourselves, and there are many things that we can do to ensure that a few nights of bad sleep doesn't change everything.
Absolutely. And it's one of the reasons I've really come to love studying the association between sleep and mental health. As you said, mental health conditions, suicide risk, there are so many factors that contribute. Sleep is just one piece of a very complicated puzzle. And that being said, part of what I love about looking at sleep is that we all do it. We all have trouble with it from time to time. And most importantly, what I want people to take away from today is that there are some really effective treatments for sleep problems and sleep disorders. So if you are struggling with your sleep, and there's so many different ways that sleep can be problematic, there's actually a lot we can do to help with that can improve mental health, physical health, and even just day-to-day functioning. And of course, there's so much individual difference. Like you said, some people can, go nights without sleeping and it has no impact on them. Whereas for other people, because of other background factors, maybe it's their biology, maybe it's their genetic makeup, maybe it's a little bit of both, plus the stress in their lives, all these different puzzle pieces, those things can come together. So much about sleep is coming to know your own patterns, what you need to feel good, because there are a lot of differences between people.
Yeah, so the good news is, and the hopeful message is, if you're having trouble with sleep, there are things you can do to improve that situation. And by improving that, you're going to feel better too. And plus, there are other things besides sleep, like exercise, diet, all those basics that are sometimes hard to keep to. Taking care of those basics really help anybody to feel better. So you work with kids. Are there differences between kids and adults?
Absolutely. Definitely major differences in sleep and lots of other things too between kids and adults. And so one of the things that we know to be true is that the amount of sleep we get on average and the amount of sleep we need on average as we age decreases over time. So if you think about infants and toddlers, they need and tend to get far more sleep. And those are the requirements that, the Pediatrics Association tell us, that babies need more sleep. As we get into elementary age, a little less sleep. As we get into adolescence, there are all kinds of changes that happen, many of which are hormonal, but also in the environment, right? That we know that because of biology and hormones during adolescence, young people start to want to stay up later and sleep in later, what we call becoming more of a night owl, and that those are biological differences that happen around puberty. And then those tend to level out more into adulthood, and we tend to start needing a little bit less sleep. And then as we age into older adulthood, we need even a little bit less sleep. And so that changes over the life cycle. But we also know that our sleep architecture changes over the life cycle as well, so that younger people tend to get more deep sleep. So it's harder to waken them from sleep. Whereas as we get older, we tend to sleep a little bit lighter. It's a little bit easier to wake up from sleep. And again, this is on average, but those are just some of the ways that we see sleep changes throughout the lifespan.
How about differences between men and women?
Yeah, also very significant differences between men and women, both in terms of the sleep timing, in terms of sleep difficulties, and also in terms of sleep architecture. And we don't totally understand all of the reasons. Certainly some of them are biological and primarily hormonal between men and women. But there are also societal contributors. Again, on average, based on child caring responsibilities. If a woman has just had a baby, for example, and they're nursing, the impact that can have on their sleep. So there are lots of different reasons we see differences between men and women, boys and girls. But just kind of on average, what we see is that women tend to have more difficulty with insomnia, so difficulty falling asleep and staying asleep, than do men. Whereas men tend to have more difficulty with what's called sleep apnea, which is difficulty with breathing during the night. So oftentimes this presents as snoring or gasping for air at night. So those are some of the difficulties we see more often in men. On average, women also tend to want to go to bed a little bit earlier. So less of those night owls, whereas men tend to be a little bit more on the night owl end. Although again, that can differ widely. I can tell you that in my household, we have completely flipped roles in terms of, I can fall right to sleep right away, but I also want to stay up much later. Whereas my husband can be in bed 45 minutes before I am. And, that's the end of it. So, so again, there can be lots of differences, but these are just a couple of the examples. The other thing that we know, because today we're talking about these links between sleep and mental health, is that we also know that some mental health conditions are more prevalent in women. So for example, rates of depression, rates of anxiety on average are higher in women than men. And we also know that sleep problems can be symptoms of these mental health conditions. And so again, lots of different reasons why we see these differences between men and women, but overall we do observe some differences.
So it's interesting, it makes me think that we should pay attention to our sleep. And if, one bad night, okay, one difficult night, wake up tired. But if you're seeing any kind of pattern in your sleep, it's something that you should do kind of like a mental health self-check. Oh, my sleep isn't good. How's my mood? How's my energy? Am I talking to people or withdrawing? And really, oh, I have a lot of stress. How am I managing that stress? And really take that as a sign to do a mental health self-check and see how you're doing. Same thing for the people you care about. If you see your child or your partner or your friend is up all night texting, then you might want to check in with them and say, hey, you okay? I noticed you were texting at 2 a.m. What's going on? So it's it's not the only sign, but it is a great sign that, hey, let's just check in and see how I'm doing. So I do want to ask you a little bit about how you study sleep, but I have so many more questions about the effect of sleep. But could you tell us a little bit about how you study sleep in kids?
Sure. So just generally in the field, there are a variety of different ways to find out about someone's sleep. And in part because there are so many different parts of our sleep and so many different ways that sleep can go awry or be problematic. So the gold standard in assessing sleep is what's generally called going to a sleep lab or having a sleep study. Generally, that's usually involves going to kind of like a hospital room, getting attached to a bunch of different kind of monitors and sleeping there so that techs can monitor, for example, your heart rate, your brain activity, your breathing, your blood oxygenation, all of these different ways that we can look at the quality, the quantity, and the physiology of someone's sleep. So that's considered the gold standard in diagnosing sleep disorders. That being said, that can be very expensive, though lots of insurances do cover it. And sometimes it can be a little further down the line. There's also a lot that we can learn by what we call ambulatory measurement. And so the way that we do that in some of our studies and can oftentimes be used in clinical practice as well are things that we call actigraphs. And actually, I happen to be wearing one right now because I'm testing it out for one of our studies. But it just looks like any old smartwatch. But these are more kind of research or clinical grade devices that tell us in a more fine-grained way about sleep wake. But certainly now a lot of these are very commercially available. They vary in reliability and validity. And so we want to be really careful that we can't make diagnoses based on these kinds of devices. But oftentimes they can tell us quite a lot about patterns of sleep, wake, and activity on a millisecond to millisecond basis. And so
Wow.
that's how we get a lot of our research data. But it's also critically important, not just what devices tell us or what our physiology tells us, but it turns out that our own experience, how we report our sleep, is incredibly important as well. Because sometimes a watch can say, you slept for a solid 8 hours last night. But then when you talk to the person, they say, oh my gosh, I'm so exhausted. I feel like I didn't sleep a wink last night. Or if I ask them, how many times do you think you woke up last night or for how long? They might say, oh, I was tossing and turning all night. And so sometimes our own experience of our sleep actually doesn't quite map on to the data we get from these devices. And that's actually equally important in understanding our mental state, and that can also affect our functioning during the day. And so really recognizing all of these different sources of information can be really important. And so in our studies, we use these watches, and we also use daily diaries where we send text messages with daily diaries to the adolescents once in the morning and once at night to ask them about, in the morning, what time did your alarm go off? How did you wake up this morning? How long did you stay in bed after you opened your eyes? How did you feel you slept last night? What did you think about the quality of your sleep? And about their nighttime routines, how long it took them to fall asleep, how many times during the night they woke up. And so many of these kinds of diaries are very widely available. You can get them on the internet. There are tons of apps out there. So if you're interested in tracking your sleep, and like you said, Dr. Jill, really, getting curious about, is my sleep a problem? And, what am I noticing? And how is that linked to how I'm feeling? These are things that you can do at home just to try and cue into, like, what am I noticing? And what are some of those patterns? And potentially those can be wonderful to bring to a provider if you think you're really having trouble with sleep and want some professional assistance and support.
So just as an aside, personal, is that I was tested for sleep apnea, and I had one of those home kits, which I was really worried about, but actually it was no big deal. It was, like a waistband kind of thing and a little whatever it's called cannula in my nose, and that was it. I thought I slept well, but turns out I have sleep apnea. And also sometimes you don't know. So I have to confess, in the middle of the night, I have audio recorded my husband snoring because he doesn't believe that he snores. So if someone you're with is not sleeping well, it can also affect you. I want to ask two more questions, and then we have a couple of questions from our listeners. So, but I do want to ask about two things. What do you think about using devices before you go to sleep? I know this is a big issue. They say just with kids, but I think it's also true for adults.
That is absolutely true. Yeah. So what we know is that as the day goes on, as daylight starts to go down, our bodies just naturally, because of our 24-hour clock, or what we call our circadian rhythm, start to release a hormone called melatonin. And the job of melatonin is to induce sleepiness. It's to tell us, oh, it's starting to get dark. It is time to wind down, to fall asleep. And that's what that melatonin release signals to our bodies. Unfortunately, what we know is that the blue light that is emitted from our cell phones, from laptops, from televisions, actually can impede the release of that melatonin. And so as a result, what that means is it can be harder, and data show that this is true, that blue light exposure can make it take longer to fall asleep and potentially even affect our sleep throughout the night. And so, in part, what we recommend is that people stay in dim light as they're preparing to fall asleep. So the hour to 2 hours before you want to fall asleep, trying to dim the lights. If you do need to or want to or feel compelled to use devices, if you can put them in nighttime mode, many of our devices now have that to at least decrease that blue light exposure. You can also buy blue blocking glasses now at like most drugstores. They're relatively inexpensive, that can decrease your blue light exposure. And there, as you're, on your phone scrolling or watching television, to try and decrease the impact that that blue light is having on your melatonin release and therefore your sleep.
So that's really helpful. So what you're saying is best to put your devices away well before you go to sleep. But if you're not going to do that, to at least do some things to prevent the effects, like using the dark option on your device, turning down your lights, wearing the blue glasses.
Mm-hmm.
It's interesting that you mentioned melatonin, because a lot of people take melatonin to help sleep, and now I understand what that's about.
Mm-hmm.
Another question. Well, I have two more questions. One, I know I said two before, but I really meant three. But because we do have a couple of questions. But one of the questions was about recently we set our clocks forward,
Mm-hmm.
and people, for at least a week, people were telling me, "Oh, I'm struggling from daylight savings." What's that about?
Yeah, it is real. There is no question. And it comes back to that whole idea of our circadian rhythm. So our bodies have this roughly 24-hour cycle that is really rooted in daylight, right? That those are the cues to our body. Basically, when it is dark, it is time to sleep or get ready to sleep. And when it is light, it is time to get up and move about, right? And so part of what happens during daylight savings time, and particularly the spring forward that we just had, is that we get less daylight in the morning and more daylight at night. And what that's telling our bodies is it's darker when it's time to wake up, but that's a mismatch with our circadian rhythm because we need that daylight to get moving and to signal to our bodies. Whereas I was getting out of work at 6 p.m. and it was still light outside all of a sudden. And so my body's saying, oh, yes, it's time to go out and about and do things. And that light was continuing much later, signaling to my body to go to bed much later. And so those effects are real. The vast majority of people do adjust over a matter of days to weeks to those circadian changes like daylight savings time. Some people can take a little bit longer. But what we recommend is rather than waiting till the night when the clocks change, because a whole hour is actually really a lot to suddenly make a shift in your sleep, right? And your wake. And so instead, if you're somebody who is really sensitive to these circadian shifts, that you might start shifting your sleep 3 or even 4 days before that daylight saving time happens, 10 or 15 or 20 minutes at a time, so that it's not so jarring to have a whole hour shift.
How do you do that? I mean, how do you shift it? Do you just stay up later? Do you get up later? I mean,
yes, just slowly start to shift by 15, 20-minute increments each day at a time until then daylight savings time comes and your sleep is aligned.
That makes total sense.
Mm-hmm.
I also like when it's light out longer, so I have to confess that for me it's worth the struggle, but some people it's not.
Exactly. And I think that points to there's so many individual differences. Some people are much more sensitive to these changes. And in particular, since we're talking about mental health, we know particularly that people with mood disorders, and especially people who have bipolar disorder or genetic vulnerability to bipolar disorder, tend to be particularly sensitive to these shifts in circadian timing, in daylight, even in seasonality, and how much light exposure they get.
Yeah, that makes sense. And, we have our Out of the Darkness walk, which is going to be in June. And it's a great walk, 16 miles or more, 16 to 18 miles. But the thing is, it's overnight. So we start in the evening and walk through the night. And while it's really terrific, we know that not everybody can do that. Mm-hmm. And so people, we encourage people, if that's not for you, maybe you have a mood disorder, particularly bipolar. There are other ways that you can volunteer, like you can do registration, you could, work at one of the snack stops, but we only want you to do the walk if you are able to manage that being up all night and the shift, and we're very conscious of that. Also, it may be that that's not the event for you. We do have our community walks, which are also much shorter, like 1 to 3 miles during the day, and a great way to be together. Mm-hmm. So another question I have is about alcohol and drugs. My understanding is these affect your sleep. Can you tell us a little bit about that?
Absolutely. There's no question that alcohol, other substances have a pretty substantial impact on our sleep. So in terms of alcohol specifically, one of the things we know is that in the short term, actually alcohol does help people fall asleep more quickly, which is also why people tend to gravitate towards it. Unfortunately, what we see very, very clearly is that as soon as the blood alcohol content starts to decrease, that actually that effect of helping with sleep that people feel with alcohol in the early stages of sleep wears off. And in fact, then alcohol is impairing to your sleep. So while you might fall asleep more quickly and maybe even a little bit more easily, it can be harder to stay asleep. And even if you are staying asleep, you're not getting as good quality sleep because you have that alcohol in your system.
So it's important to watch your alcohol intake
Absolutely,
especially near bedtime.
Absolutely.
I think with drugs is like there's so many different drugs, and so I think we'll maybe save that for another time.
Sure.
Because there are some questions here. So one question is, what is there a recommended length of sleep for adults? I think I already know the answer to this, but
the answer is yes and no. So is there a recommendation? Yes, there is. On average, what is recommended is 7+ hours of sleep for your average adult. Now, that being said, like we've said before, there are so many individual differences. And so much of this is about knowing what is normal for you, what you need to feel good the next day, to feel clear-headed, to function well. For some adults, it can be perfectly healthy to need 8, 9, even 10 hours of sleep a day to feel good the next day. Some people need less than that. So there's really quite a range. But generally speaking, the recommendation is we should all be getting about 7 or 8 or more hours of sleep a night.
That's really helpful. I know there are people in my family. I'm always up, the first one up in the house, but I always marvel at the people who can sleep for hours and hours. But then I see that they need it.
Right.
And it really makes a difference for them. Somebody else was wondering, is there any link between, sleep, mental health, and dreams?
What a great question. Yeah, there's a whole literature around dreams and what they mean and interpretation. I'm definitely no expert in that area. In terms of specifically with mental health diagnoses, what we know is that if you are someone who's having repeated nightmares or disturbing dreams, those can be symptoms of mental health conditions. So for example, post-traumatic stress disorder, nightmares can be a symptom of PTSD. We also see that people who have a lot of anxiety disorders or anxiety symptoms can be having more vivid dreams, more concerning or worrisome dreams. And so sometimes our dreams can be telling us something about our mental health. Sometimes dreams are just dreams. We all dream. Sometimes we remember it. Sometimes we don't. All of it is within a normal range. And if you're someone who's having upsetting dreams, if you're waking up from your dreams and your heart's racing, if you are, having recurrent dreams about upsetting or concerning or disturbing content, those can be signals of a mental health condition.
Okay, so if you're having those kinds of dreams or sleep difficulties, it's a good time not just to do a self check, but also to see your health or mental health provider and have a conversation with them. Doesn't
Exactly.
this, sleep is just a sign. And someone asks about what about if you have long term problems with sleep? I would think that that's something you want to try and address before, obviously, before they become long term problems, but you can't always do that. So, is that different, or how do you deal with long term problems?
Yeah, it is never too late to go seek some assistance if you're having sleep difficulties. Agreed. If it's something that's going on for weeks on end, if it is causing you difficulty at work or in your relationships, if it's making you more crabby on a long term basis or even a couple of weeks, those are good times to both, monitor it some yourself, collect some data that you can then bring to your provider to talk about what is going on. Is it something that can be changed with, working on your sleep patterns? Is it something that needs treatment? Because again, there are really a host of different treatments that are very effective for different sleep problems. So what I would say is if you are someone who's been struggling with sleep on a long-term basis, please go get help because there are so many ways that potentially the field can help you to sleep better, to feel better.
So, it's not just that you're a bad sleeper, but that in fact you can do something to fix it. And so, a lot of times we have things that, we need help to fix, and then it's so worth it once we get it fixed. So, there's, it's really important to seek help when you need it, and not just suck it up, as they say. Because it's
Absolutely.
like, think about something like sleep. Like, there are things that you can do to help it. So, check in with somebody. So somebody else asked, what do you do to encourage someone to turn off gaming at night and go to sleep? And by the way, that's not just kids. Again.
Yes, that is the $1 million question, especially because I also work with adolescents. And so, on the one hand, we're talking about how, there are all of these really effective approaches to improving sleep. And changing our behaviors can be really hard, right? Um, and so, absolutely, when it comes to gaming at night or being, texting with friends at night or engaging socially at night for young people and also for older people, unquestionably. Oftentimes what we can do, some of the approaches, there's no one right answer, but it's to try and figure out how can we help that person get those needs met at other times. There's a good reason people are staying up late and texting with their friends or talking on the phone or, watching Netflix or whatever it might be. And so a lot of the kids say that's my only chance to unwind. I go to school and then I go to soccer practice and then, I come home and have dinner and then I do my homework and then it's 11 o'clock at night and I haven't had a chance to just chill. So that's like one example of how we might hear it. The same is true for adults too. And so trying to figure out, are there other ways that you can unwind? Are there other ways that you can connect at other times? So that's one option. Another approach is also to figure out what motivation does that person have to change the behavior, right? And so helping them to see how they could feel better, how their life would look different if they were able to get more sleep or get better quality sleep, to help them recognize how this delayed sleep or gaming at night or whatever the problem sleep behavior is impacting their ability to do well in school, for example, to get along with their partner, to do well at work. All of the different ways that poor sleep can be getting in the way. And if we can help people make a link between those two things, sleep better, feel better, oftentimes then we're more able to help to change some of those things at night, especially that get in the way of good sleep. And to be clear, it can be challenging, but that's also where, if you're really seeing difficulties, I encourage you to seek help because there are professionals whose whole job is to help people work on these health behaviors like sleep.
I think it's also important to keep in mind that these are things that are in control of people. And even when they're out of control, they're still in control. And I say that because, for instance, telling a teen, this is messing you up is not going to work because they're like, get out of my room. But if you say, do you think that you are at your best? Do you feel that you're functioning optimally? Or how was soccer practice when you were up till 3 a.m? Whatever it is, remember that the ball is in their court.
Right.
And so helping them to come to the idea, say, I really get it. Your day is packed and you want to do this to relax. I wonder, what else could you do to relax? What else do you like? Rather than what we often have a tendency to do is just sort of say, nag and wag. So naggy waggy doesn't work. So someone asked, can you list what a few best practices are for adolescent bed routines? And I'm guessing, again, it's probably good for all of us.
Absolutely. I love that question. And it is true. By and large, we call it the wind down routine, is pretty similar recommendations for children all the way through adulthood. So the idea is that we give our brains and our bodies a chance to slowly wind down. And so sometimes I think about when I was a kid, I used to have those little wind up toys, and you would wind them up and then they would slowly go to the point where they weren't moving anymore. And basically, that's the way our bodies need to wind down at night too. We can't go, 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 and then just expect to turn it all off. It's more like a dimmer switch. And so some of the way that we can help with that dimmer switch, that slow wind down, is to turn off screens an hour and a half before bedtime. Be in more dim lighting during that period leading up to the time we want to fall asleep. Also doing things to help our bodies and our minds wind down during that time. So for example, I am someone who used to watch the news at nighttime. Increasingly, what I have found is that gets me worked up. It both emotionally and cognitively. I start to have worries. I start to think about worst case scenarios. Those kinds of things that get you emotionally charged or get your brain going in a worry spiral are things you want to avoid during that wind down time. Doing things that help you relax. It might be taking a shower or taking a bath. It might be reading a book that is not terribly, maybe not something super scary or super intense. It might be, talking to someone else in your home quietly. So low noise, low light, slowly winding down over that period so that you're giving your body and your mind the chance to get ready for bedtime, as opposed to thinking you can go, 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 and then stop. Does that help?
Yeah, I think that's really helpful. And I think it's important to remember to have a routine of those things. And once you get in the routine, your body will start winding down on its own as you do your routine. So it's not, once you do it over and over again, it'll come naturally. And I don't know, it reminds me when I was in graduate school and I had a professor who did history of psychology, and it was always during the lull in the sleep cycle around 2 o'clock in the afternoon. And so my friend and I got trained that we would start to fall asleep on the way walking to that class. But it was true that we had a habit of going there, and he had a very deep voice. And so your wind down routine will eventually take on a life of its own.
Absolutely.
That will naturally wind down. And some people use the apps, and there's even an app that has boring stories to go to sleep to. And it's like in a very deep monotone. And whatever works for you is the best thing to do.
Exactly. Some people find that doing like relaxation during that time, mindfulness practice during that time, there's so many good and helpful apps. It really is about finding what works best for you. The other really important thing about that wind down routine is really trying to have a set time that you start that is almost the same every single day, whether that's a weekday or a weekend, because that is one of the big problems we see not only in adolescents but in adults as well, is this big shift in what time you go to bed and what time you wake up on the weekdays or work days or school days from the weekends. And so part of that routine is not just what you do, but when you do it, and really trying to have that be very consistent day to day.
Totally makes sense. I mean, we have routines for everything, right? We have our brush your teeth routine, your breakfast routine. So a routine for sleep makes complete sense. I want to backtrack to, you were talking about things you can do to improve your sleep. And somebody said, when you talk about ways to improve your sleep, well, I want to ask you, could you be more specific about some of the treatments? And they were wondering if you were talking about medication.
Great question. So medication is one option for treating sleep problems. And so I will say it's kind of vague because there are so many different ways that sleep can be problematic. There are different sleep disorders, different sleep symptoms, and there are different treatments for them. And so that being said, to some extent, it depends on what the problem is, what the most effective treatment or treatment regimen might be. So medications, those can be prescription medications. There are also over-the-counter medications. So both of those are an approach to treating sleep problems. There are also therapies like cognitive behavioral therapy, talk therapies, that can help with some specific sleep problems that have been shown to be really effective. There are also light interventions to help shift your circadian rhythm. So some folks may be familiar with light boxes that people can sit in front of in the morning, for example. If you're someone who has so much trouble getting up in the morning, you may need some extra light to boost your circadian system to say it's time to get going. And so light therapy can also be an option. And then there are also lots of behavioral interventions that we can do. So in terms of our wind down routine, our wake up routine in the morning, making sure we get activity during the day, that can all be part of interventions that can really help sleep. There are also devices that can help sleep. So Jill, you mentioned a device for sleep apnea that you use that helps you to breathe more regularly so that you're not waking up during the night. There are other devices as well, depending on what sleep problems you have. So seeing a sleep specialist, starting with your primary care physician, talking about what are your concerns, and then if you need to go to have testing or see a sleep specialist to determine which one or more than one of these treatments is going to be best for the concerns about sleep that you have.
And you might have to try more than one, but it sounds like one of the really key points is to start monitoring your sleep. On your phone, you can put an app that just measures basically your breathing, or that you can put it on your mattress. I'm not good at that because I'll probably kick it off, or push it off. But that you can see, are you getting a restful night of sleep? And you do that a few nights in a row because you want to make sure that it's not just one night. So that's one thing. That's something I did. I put the one where it measures your breathing during the night. Another thing that you could do is, the point is that you have to have a really thorough history taken, and anything you can bring in that helps them to, like, use an app on the side of your phone. Ask if you have a partner sleeping there. Ask them what they see during the night. So there are many things you can do to prepare to go get an evaluation, and then they know what to ask. So they will ask you a lot of different questions and some of them may seem a little strange, but that's okay. The other thing is, I want to say, even at AFSP, we have funded research that has shown that looks at a form of cognitive ICBT for itself.
CBTI. Mm-hmm.
And not only did it improve sleep, but it also reduced suicidal ideation. So these treatments do work very well. So I think that there's so much you can do, and there's no reason to worry about it. I want to just say, for my sleep apnea, which was discovered because my oxygen level was low, and oddly, I knew I wasn't sleeping well and waking up a lot, but I didn't interpret it as a problem until I went for a procedure. My oxygen level was low, and they almost didn't do it and told me to see a pulmonologist. And so the device I use is called a mandibular advancement device. And some people use a CPAP machine, and there are some newer things on the market as well. So also you can do your due diligence, and there's lots of access to information, but don't over access information without talking to a health professional. One person is saying that they sleep 3 to 5 hours a night and have for years, and then they were just diagnosed with bipolar disorder. And how can you address the bipolar disorder that is often diagnosed, has sleep problems with it? And I didn't read that exactly right, but I do want to say something about light therapy. If you have bipolar disorder, make sure you talk to your clinician, because some people actually do not do well with light therapy if they have bipolar disorder. So don't just go out and buy a light. There is a science to it, and make sure you do it with a clinician. But so how can bipolar be diagnosed, and when often just the sleep is being addressed?
Yeah, it's a great question. And I want to even go a step further of what you said, because I think it's so critically important in terms of the light therapy. I would say for anyone considering starting light therapy that they consult their provider to make sure that they're getting the right dose, just like they would with a medication, and that they're using it properly. I just
want to say, it seems so simple. Like, what could light possibly do?
Right.
But it's a very specific light, very specific position, very specific amount of time. And even though we may not understand it, and it probably has to do with circadian rhythm and things like that, it is a potent treatment. So
absolutely.
Okay. So if you're having sleep problems, and how do you end up knowing you have bipolar disorder? Like, what's that connection about?
It's a really good question, and it turns out it's pretty complicated. So what we know is that sleep problems are both a symptom of the two poles of bipolar disorder, which are depression, which is low mood, but also mania and hypomania, which is high or irritable mood. And so when folks who have bipolar disorder are in a depressed episode, they might be sleeping too little or sleeping too much, or alternately sleeping too little and too much. Whereas when somebody is in a manic or hypomanic episode, they might be, one of the symptoms is that they could be sleeping too little, but still feeling energetic during the day. So for example, if you are sleeping 3 to 5 hours a night and still feeling great during the day, having lots of energy, being able to get things done, then that might be a symptom of mania or hypomania. And so what's hard for me to tell from this question is, are these sleep problems episodic? Because if they're episodic, meaning they're clustering together with other symptoms of mania or hypomania or depression, then likely they are symptoms of your bipolar disorder, which we expect that good treatment for your mood disorder would potentially be helping to stabilize your mood, but also helping to stabilize your sleep and circadian rhythms. Now, that being said, it's also not uncommon that people with bipolar disorder can continue to have sleep difficulties even during times when they're not depressed or not manic or hypomanic, which is why it's so important to make sure that you're talking with your provider about these things. But also in our work with folks with bipolar disorder and at risk for bipolar disorder, we have them closely track their mood and their symptoms as well as their sleep on a daily basis so that we can better understand these relationships between symptoms and sleep problems so that we can figure out how to best treat both of them. The other last thing I want to say about that is we also know that sleep changes can actually precede episodes of depression and mania and hypomania, almost like a red flag that something might be coming, right? So for example, before I get a cold, I tend to get like a scratchy throat. And that's usually my first sign that, like, oh my goodness, I'm probably going to get a cold 2 days from now. And sometimes in people who have bipolar disorder, what they notice, and the data suggests this as well, that their sleep can start, their mood could be stable, their sleep might start to change, and that could be one of the first symptoms that maybe they're starting to become manic or hypomanic, or starting to become depressed. So it's a great question and a complicated one. And that's where we recommend closely tracking your mood and your sleep and bringing those to your provider.
Yeah, I think when we're talking about mental health and we're talking about suicide, there are so many factors that come together. And I'm glad that we got to spend some time talking about sleep, both as a sign of what's going on, also as a potential symptom of what's going on. But the bottom line is that, we need to pay attention to our sleep. And I also think I'm so grateful, we are all so grateful for your work, because some of this we didn't know until you started doing your research. So I want to thank you so much for being here today. And I hope people learned a lot about sleep, what you can do to help make it better. If you're struggling with your sleep, you're not alone, and B, you don't have to struggle. There are ways to get help. So Dr. Goldstein, Tina, I could talk with you all day. It's always great. The wealth and depth of your knowledge and your caring attitude are so important. So thank you so much. Come to afsp.org/research. If you have other research questions or want to see what we're doing, we have all kinds of information. Follow us on social media at AFSP National. We're having a lot of advocacy work going on, so become an advocate. To go to our advocacy center. And if you or someone you know is either struggling or has lost someone to suicide, we have some really helpful resources and programs for you. So thank you so much for being here today, and I hope everybody gets a good rest tonight.
Thank you.
Christine.
Thanks for having me.
Bye.